My disclosure statements, we do work in the area of some of the compounds I'll be talking about. I don't see how it has any real application, though, to this, the presentation today. You know, why address this issue of what's the value, what's the potential risk? It's already been stated, this has been recognized for centuries, that the dose is the poison. By definition, any nutrient taken in excess, there's a point it's going to represent a risk. I think for the individuals in this room, though, what's of concern to us oftentimes is that that window of safety for what we think represents an adequate intake versus an excessive intake can be relatively small. Easy examples for nutrients I work with are zinc and copper. The difference between what we say, this is a good amount based on some DRIs versus, oops, we now slipped over the UL, is only a factor of about 4. So relatively small windows, and I think it's easy for us to forget that. Simultaneously, we tend to forget that just because we go past that UL doesn't mean we necessarily are going to have toxicity. It just means we're in uncharted waters. And so we have this curve that many of us look at and we utilize it, and we tend to forget that this nice stylized curve is, again, it's all about probability of risk. It's not a definition of risk. And when we look at the DRI curve, again, it's already been talked about this morning, but it tends to get missed, I think, also by the lay public often, is that the amount needed to minimize risk for inadequacy can oftentimes exceed that, which is commonly available through the consumption of diets that do not contain fortified foods. And as you illustrated earlier this morning, vitamin D, iodine, folate are all examples of that. In theory, this nutrient gap between what natural foods and diets might provide versus what we want from them will likely expand as health expectations of our diets are increased. I think this is a concept that we oftentimes don't get across to the public very well, because you constantly hear, well, you don't need supplements because if I just eat a good natural diet, all will be well. And it's difficult to argue with that because it sounds so good. And yet, the individuals in this room recognize the fact that we do have a value for fortified foods. So the concept, the principle that oftentimes there's things that we can do from a micronutrient basis above and beyond natural, healthy foods has already been established. That should not be a subject of debate. What is a little more fuzzy, though, is what do we really want from some of these nutrients and diets? So here we have on the top curve just a hypothetical curve for vitamin D, but based on the outcome which it currently is, such as bone health. And we can draw an ICAR or DAUL. We can show zone of safety and say the toxic range is way away. But all of a sudden it gets confusing if you start changing the curve. So again, hypothetically, if you look at a series of papers that have been coming out the last 4 or 5 years that say vitamin D also has influence on endothelial health, but you need much higher levels, well, suddenly where we start drawing the curve and what the window of safety is might change quite dramatically. And we need to be open for that. What I'm going to do in this presentation, and this was at the urging of the panel, which I was a little bit confused how to respond to this, is they said, why don't you focus on flavanols? Well, that's an interesting concept since we don't have a DRI for flavanols, so suddenly we have to draw brand new curves. And so this will be just a theoretical presentation, but I'll try to build the case of how we might be looking at it if maybe we're starting from scratch, and that kind of gives us a little more freedom. And we'll do this using flavanols because they have been postulated to have positive health effects, primarily work over the last 5 or 6 years. And so we'll look at some of the considerations that maybe we should have when we start thinking our way through this. Why flavanols to begin with? We start with an accepted fact. Diets rich in plant foods associated with an overall positive health status, particular decreased risk for some diseases like vascular disease. So that gets us firmly in the realm of just eat a good diet. The problem, of course, is that while most of us would endorse conceptually that last slide, there's actually very few studies that have been conducted prospectively that shows that increasing the consumption of fruits and vegetables in the absence of other dietary advice or other lifestyle interventions really has a major impact on CVD risk factors. So quite surprising. This was initially pointed out by Duchan in a paper in Nature about 5 years ago, but then recently Hartley's group came up with about the same result in the meta-analysis of the field. And in part, this may be because it's very complex. That inverse association may be due to multiple factors. A good sodium-potassium profile, low in saturated fat, high essential nutrients, high fiber. The problem with many of those hypotheses is when they've been directly tested, the results have been less than gratifying. So we oftentimes fall back on this other category. Well, it's high in select non-essential phytochemicals. The trouble is how do you get your hands around, well, what phytochemicals? One class that got attention several years ago was the flavonoids. And it was a great paper out of Hertog's group which showed a very nice inverse correlation for your risk for cardiovascular mortality, which is your flavonoid intake. While this slide is often cited and used, it's important to note that it was a very limited analysis of the type of flavanols they looked at. This becomes important because if you suddenly say, well, let's go back to the whole diet approach and look at different fruits, look at different vegetables, their profile of those compounds change considerably. So if hypothetically it is a flavonoid or class of flavonoids that are driving this, well, then dietary recommendations become quite different. So one says, well, maybe you just don't eat 5 a day or 7 a day, but we should have more specificity. So it gets confusing. Testing that hypothesis has been a bit difficult because, again, it's a little bit on the vague side. It's, well, how do flavonoids hypothetically influence vascular function? And people suggest everything from changes in oxidant production defense, alterations in the immune system, platelet reactivity, vascular reactivity, tissue repair, blood pressure. One almost gets the idea that it could be pixie dust and it just does everything, which of course is unrealistic. But where this becomes an issue is, well, what biomarkers are you going to start following in terms of functional readouts if you're saying, well, it's acting through multiple channels? And I think in that regard, it's important. A report I haven't heard mentioned this morning, which is a bit surprising, I think pertinent to us, was the 2010 biomarker and surrogate endpoint report. That's, when you go through it, talked about the fact that as nutritionists, we should be a little more careful about how we use biomarkers and how could we potentially employ them in looking at acute versus, say, chronic effect of, in this particular case, phytochemicals and select health parameters. And I think recommendation 3 is particularly important for us, even though it can make us uncomfortable, and that is the FDA should use the same level of scientific rigor for looking at biomarkers across regulatory arenas, whether they're for drugs or in our case, foods or dietary supplements. That clearly has not been the case. It changes the way we do business if we actually go down this road. So let's see, first off, well, can we use biomarkers for nutrient/flavanol status here? Well, it's pretty hard if we're just trying to get status. This is an example of a simple cartoon of what happens if you give a person a high flavanol beverage, collect blood over about 6 hours. The two principal nutrients that you pick up in circulation are epicatechin and catechin. We'll do more about them later. But what I want to really draw your attention to is they're virtually undetectable prior to the consumption of this beverage, and then they basically vanish by 6 hours. So as opposed to many other nutrients we've been discussing this morning, in fact, all of them, the fingerprints of the fact you consumed them in the morning may be gone by the evening. So it's not clear if you have a good biomarker. You do have a number of metabolites, but these vanish just the same as the parent molecule. It raises another issue, though, is we're not sure if some of the data I show you very briefly later, if they're driven by the metabolites, if they're driven by the parent molecule. So when we're assessing status, what really should we be assessing? And that is status as it relates to the intake of the specific nutrient. There are some hints of some compounds we can look at. In particular, valerolactones. Minus epicatechin and other flavanols will be converted to this in the lower gut. You can pick them up perhaps over 24, maybe even 48 hours. There's been some suggestions in the urine. They may provide an indication of flavanol intake. Unfortunately, long-chain procyanidins also will degrade in the gut. They'll also provide valerolactones. So what they'll do is they give you a potential measurement of the intake over the last 4 or 5 days of not just flavanols, but also oligomers of flavanols. That would be all right, except the data currently suggests the long-chain oligomers don't have the vascular effects that the short chain does. So this can be a marker for fruit and vegetable intake, perhaps, or some seed intakes, but not for flavanols per se. So we're kind of stuck there. We simply don't have a biomarker at the moment for looking at this particular nutrient class in terms of saying how much have you taken in or how much do you routinely take in. So what if instead we say, well, let's look for biomarkers for efficacy, flavanols. Now, antioxidants got a lot of attention recently, so you can easily assess someone's antioxidant status. But as EFSA, I think, pointed out recently, it really seems not to be a good way to make health claims, and I would endorse that. These compounds, while they're potent antioxidants in vitro, they really don't seem to be in vivo. So what if we start stepping out of the normal ones we think about? Look at, say, platelet function. Basis here would be, well, platelet function has been accepted by EFSA for some compounds, such as tomato concentrates. And if we apply that, this is a very busy slide. All I want to draw is that if you give flavanol-rich beverages to individuals, or flavanol-rich foods, multiple labs, multiple countries, in relatively short time periods, up to 4 weeks, but as short as 1 day, you get reductions in platelet reactivity. So that's looking like it could be a potential way, a potential biomarker for efficacy. Vascular function has also been suggested, particularly flow-mediated dilation. And again, the European regulatory agencies have now taken the position that measures of vascular function, such as FMD, can be used in support of health claims. And FMD-PAT, again from the European perspective, but also in the US, looks like it could be a surrogate marker for blood pressure. So one can start saying, well, this ties into biomarkers which are currently acceptable in the United States. The thing here is, again, much like that platelet function, as I noted, you can get those results in 1 day to 4 or 5 days, though they're transitory. They're gone after a few days. If you look at FMD, you can give, say, a flavanol, in this particular case minus epicatechin, and you can show immediate, within 2 hours, improvements in endothelial function. At least we believe that they're improvements. You can do this using also by PAT, so that is looking at blood flow in the finger using physmography. And these are at amounts which are equivalent to what you would be giving in a food or a beverage, if it's isolated. Again, a busy slide just to drive home a rather surprising point. This is a very consistent observation across multiple laboratories. So you get very quick responses to this particular class of nutrients by platelet function as well as by vascular function within literally a matter of hours. If, however, you follow this for long periods of time, say a period of 28 days, what you observe is that your baseline flow-mediated dilation value starts to increase, which is quite good, but your ability to detect the influence of that flavanol acutely starts to get incredibly difficult. So if you start thinking about, well, we want biomarkers of efficacy or nutrient status, and you chose endothelial function, it may work really well initially if you're saying, what is this person consuming for 1 day? But if you have somebody who actually has quite a good diet and a very good vascular system, it may not be a particularly good way of assessing function. If you say, let's default and turn to blood pressure, that sounds good, except here the data get very confusing. As opposed to looking at endothelial function as assessed by FMD, PAT, or platelet reactivity, blood pressure gives mixed results, and it's not clear why. Another marker that's being used recently is arterial stiffness, and again, the EFSA has accepted this as a regulatory support system for some health claims, particularly around CLA. And it turns out that both pulse wave velocity, which is linked to increased arterial stiffness, both of those can be shown to indeed be improved in individuals in, say, high fruit or vegetable diets, which is reassuring. Or under controlled conditions, if you take high flavanols, you can decrease pulse wave velocity and aortic augmentation, again, within a matter of an hour. And if you look at that over a 2-week period, you continue seeing improvement. So what we have is a whole number of different biomarkers, if you will, where you could say assess an individual's flavanol status if you want to look at the response to how what this individual has to a food or a beverage or a supplement that might potentially contain it. The downside is most of these studies have been about 30 days in nature. So all that's sounding great. You can take these, there's about 1,000 subjects approximately, and some data that Gunther Kuhnel recently started to analyze. It's unpublished at this point. And it's a significant effect that across you get with these studies, suggesting that this intakes of this nutrient are positive for vascular function, which looks very encouraging. Then everything almost seems to fall apart. Because if you look at diet intervention studies, and now rather than use broad classifications like flavonoids, you start saying we just want to look at the minus epicatechin, or we just want to look at catechin. It's not as clean suddenly. You do not see really clear differences that, quote, high intakes of these from the diet seem to be associated with reductions in vascular dysfunction. Where this becomes clear as to what might explain this, though, is the diet intervention trials have been consistently done using amounts which exceed what you find even in the upper 10th percentile of intakes among the populations at large. So this seems to suggest, if we will just posit for the moment, that these results can be verified and it can be shown again, that this may be a case of a nutrient that when taken at higher levels than which is normally consumed in the diet, seems to have clear-cut positive vascular effects. So what do we do with that? This would seem to be a prime case of we're saying maybe fortification has value. But are there safety issues? Because by definition, we're talking about intake levels, which are higher potentially than what we have historical records in terms of diets about people consuming it. So then we have to fall back and say, well, we do risk assessment or safety evaluations, which always have at least three components: the hazard, which is the potential for cause and adverse effects; the risk, which is the probability that they might occur at specific doses; and then finally, really, what is that safety where we think we're in very little chances of anything going wrong. And now you start getting worried again, because if you go to flavonoids and just simply punch into PubMed, toxicity, risk factors, there's all sorts reported. There's anti-nutritional effects, inhibition of proteolysis, thyroid toxicity, drug interactions have been reported for the flavonoid family. Genotoxicity, there's developmental effects. So it seems pretty grim. But when you then look the papers up, you realize that the term flavonoid is used in a very cavalier fashion. It's covering literally hundreds, if not thousands, of different compounds. If you look specifically for one, minus epicatechin, at least I can't find literature reports that that specifically is toxic. Yet that's the one that seems to be the compound, the specific type of flavonoid driving some of the vascular effects. And I think this shows an inherent risk of when we're considering the toxicity side, is not being precise as to what it is we really are looking at the toxicity of. And in complex foods, that of course is very difficult. If you're doing a food fortificant, it might be a little bit easier. So we start generating curves like this where, as opposed to that initial one that said, well, here's the distribution for this nutrient, you have a hypothetical distribution that is from diet, another one that could be from fortified foods, another one from supplements. You take them all together. And as has already been alluded to in this several times this morning, where your safety zone in could be completely different depending on what combination of these that you're considering. So we have to have additional studies for, I'll say, flavanol as an example. And as opposed to trying just to get ULs by here's what the population consumes, what seems to be safe, because in this level, hypothetically, the intakes we might want to go after exceed typical diets, we need to do standard type of studies. Intake level escalation studies where we take 1x, 2x, 3x, and that 1x could even be 2 to 4 times higher than levels currently being used that have been shown reported to be efficacious in clinical trials. Then you follow the appropriate readouts: blood pressure, platelet function, standard metabolic panels, circulating flavanol concentrations. It's just descriptive work, but it's ultimately, I think, what we have to be doing so we can get out of this conundrum of assuming that the UL is some sort of line in the sand. The UL at this point is simply, well, we think you can take that level with no risk. After that, again, you're in uncharted waters with monsters. We need to start defining, I think, what the limits are. And then you would typically do a phase 2 trial where you run it for several months at whatever the higher dose is that we've not seen any negative effects with. The need for some of these type of studies, I think, is underscored. A press release which came out last month from Brigham and Women's Hospital and the Hutchinson Cancer Research Center in reports that they're going to be doing a study, many of the details still have to be worked out, of looking at 18,000 men and women over a 5-year period, evaluating whether flavanols can have some of these effects or not. I think it's very encouraging. It kind of would set a new standard of how we should start saying, well, if we're going to use a supplement for a specific nutrient, what's the level of evidence that we want before we can say, okay, this really looks solid. The downside, it's not realistic for every single new nutrient out there, or postulated nutrient, to run trials that have 10 to 20,000 people for multiple years. The expenses would be crushing. But I think this could at least give an example of how to do it. Then we can say, well, now, if the flavanol story works, can we just throw it into different foods? And the problem is no. So it gets tricky again, because we have food processing issues. Quite simply, that's an issue because flavanol stereochemistry affects the absorption here. So I've used the word minus epicatechin a few times on purpose, because if you give purified minus epicatechin versus purified plus catechin, or minus catechin to normal human subjects, it turns out it's specifically minus epicatechin that seems to be absorbed the best. And if you were to infuse these pure compounds using an animal model, you can show that the stereochemistry also seems to affect bioactivity. So again, the precision we have in our data sets and our tables and food composition that say flavanol may be of limited value. We have to specifically say what type of isomer. And for food processing, this could be a nightmare, because you do something as simplistic as heat your tea at the wrong temperature, and you can degrade your minus epicatechin so that you wind up with plus catechin. So if we start thinking about food fortification as a potential vehicle for this hypothetical example of flavanols, we'd have to go through the entire processing of whatever that food or that beverage is, or what that supplement is. Are we still maintaining what we think are the active constituents as opposed to a general class? So moving forward, and again, I want to stress the point here is not to say, oh, let's move forward with flavanols. It's simply to say, what if we step out of the well-recognized essential nutrients and say, what should we be doing in the future? What are some of the concerns? But now using the flavanol to illustrate this, we have to further define what's the amount of this nutrient that's really needed to achieve optimal, in this case, vascular function. I would submit that makes more sense than saying, well, what's optimal status? We can't measure optimal status of virtually any of these essential nutrients now, and we should be focusing more on, do we have short-term markers for whatever the physiological effect we're trying to get. We need to have a better understanding of the stereoisomer specificity for those nutrients where this is maybe more important than previously thought. The persistence of acute effects needs to be better definition. We really don't know what happens over a year or 2 years. While it might seem, well, how would you ever at an NHANES evaluate vascular function? Again, I think with some of the new techniques and some of the wearable methods that people are doing now for following blood pressure, these are not out of the realm of where we could be in 4 or 5 years. But knowing what occurs over 1 week, 2 weeks, 5 weeks, may be the explanation for why the diet data is not matching up to the intervention data, is years of intake at the higher levels may have effects. So you might think about, well, that's what ideally we want to have. If you have someone with compromised vascular function, you start them at perhaps a lower intake, but like any other supplement, you don't always have to do it at that. You can start titrating it down. We need to understand the mechanisms of action better, because that will allow us to predict what are things which may augment and what are things which may be to the detriment of this particular class. We need safety threshold levels better established. That's not just the level that says, well, we know you can take, or we think you can take this amount in for long periods of time with no risk, But we actually do have to start getting the sense of where does risk start occurring and quantitate that better, as opposed to having it to be almost magic. Flavanonutrient interactions, we have to define them better. The characterization of diverse food processing techniques, storage conditions, and all of these are needed. It's much like the presentation we just had. You can say it's great, but if it goes on the store shelf and a week later it's completely changed, what are we really doing? Ideally, I would submit biomarkers for flavanol status also as it relates to the specific compound. Hopefully, in the near future, we'll be able to identify some metabolite which gives us a better hint. I would be astonished if it's going to tell you minus epicatechin, but we might be able to find something that tracks with other flavanols or other flavonoids. So it may be class status sort of nutrient indicators we have to be thinking about. And I think we have to really ask ourselves then if food fortification would be a valuable approach to meeting potential future dietary recommendations, not just for this nutrient, but for other nutrients that we're trying to say we have to use it under the new health, positive health paradigm. We all know that we have to do something different given the crushing medical costs that we currently have with standard drugs. And maybe it's time to go back to the mantra that ideally diet could be your medicine, but it may not be the diet that we had readily available a decade ago. Thank you.